I know this is an iPhone cord, but we're going to pretend it's a tube. What's up everyone, I'm Dr. Patel, a facial plastic surgeon here in Beverly Hills, and in this video today, I'm going to be teaching you about surgical drain care. Drain care 101 is critical to getting the results you want. So before we begin, what is a drain? A surgical drain is a negative pressure system that helps evacuate any fluid or blood from a dead space. What the hell does that mean? Now, in many surgeries, whether it's a tummy tuck, a neck lift, or a facelift, we're removing and repositioning tissue and creating an area in which there's a gap or an opening. Your body likes to fill this with things we don't want it to fill with, and so what we're doing is we're using a bulb with negative pressure and a tube attached to that to suck any of this out. Now, why does that matter? Those things can cause problems from complications to a prolonged recovery. So your help in helping your surgeon out is going to make the difference between good results and great results. In this video, I'm going to explain to you how to best take care of your drain. Now, let's get back to the basics. So a surgical drain is going to be a little tube with openings in it. This is where your surgeon gets to decide the size of the tube, the length of the tube, the style of the tube, but for the most part, these are going to be implanted in specific areas. For me, I'm today talking about a deep neck lift in which I'm implanting two tubes usually, one on top of the platysma and one underneath to evacuate both areas. Now, these drains are specifically going to begin by making sure that we're not building up blood. This is called a hematoma, and it's a pretty major surgical complication that can lead to major issues from skin death to pressure on how you breathe. And a drain is usually the first step in identifying there's a problem. When it repeatedly fills up, we know that there's a lot of blood coming out and you need to identify this and let your surgeon know immediately. Now, when it comes to the drain itself, what we're doing is looking for initially dark red blood. Any surgery is going to lead to little bits of blood that come out, and any amount we can take out is going to lead to a better and smoother recovery process. It's normal to have more initially, but over the course of the first 24 hours, it should be decreasing and less blood should be coming out. Over the following ensuing days, you're going to notice that the liquid changes to what we call serosanguinous, or a yellowish fluid tinged with blood. As time goes on, this is going to change to a sanguinous fluid or just a yellow fluid, and that's the proteins that your bodies are exudating or releasing during the healing process. And this is going to lead to a lot of hardness, and getting that out is once again also going to help the healing and recovery process. Now, what are the important things you need to do in order to take care of this? So the first thing is this drain is coming out from a random opening made somewhere in your body, whether it's a tummy tuck site or a neck site. It's going to be in a hidden area and it's going to be stitched in. Their tube is going to basically be tied down to your skin so that you don't accidentally pull it out. That being said, be careful with pulling and tugging on these because they can slip. Now, this is a pretty simple negative pressure system where on one end we have a bulb and then on the other end we have a tube. I know this is an iPhone cord, but we're going to pretend it's a tube.
It's about imagination.
All right, fine.
This bulb is held to negative pressure, and then the tube's connected to the other end. This tube on the end that's inside of you will have small openings that you can't see, but this is sucking through this plastic tubing. It'll be taking any liquid from inside your body and getting it and evacuating it through this tubing system. This tubing is really important because it's going to fill primarily the tubing instead of the bulb. So the first thing you want to do once or twice a day is what we call stripping the drain. This is when you're going to be taking one finger close to the opening, holding pressure, and using your other hand to slowly evacuate any of the blood. Now make sure you're not just pulling, so one hand needs to hold firm pressure and get all of the blood out until it goes into the tube. The second thing you're going to be doing is emptying the drain. Now this basic system is going to be first released and then through that same opening that was plugged, emptied into a graduated cylinder. Now for the most part, we don't need to be accurate initially, but prior to drains being removed, we want the drains to be putting out about 25 to 30 milliliters a day before we remove it. This is very surgeon dependent and surgery dependent, so make sure you ask your surgeon on how much he or she recommends before you go into the office to have your drain removed. Once this negative pressure is released and tube drained, we want you to reapply that pressure. So you're going to squeeze the bulb and then you're going to recap it. Once that's done, you'll notice the bulb stays with it pinched, and that's what we want, meaning there's negative pressure taking everything out. If it slowly releases over time, you need to let your surgeon know, but chances are there's a leak somewhere in the system, either here at the opening or at the opening on your skin. What you can do for the opening on your skin is reapply ointment over that area so it creates more of a seal, and that should help solve the problem. But if you're concerned about it or it's not holding suction, please let your surgeon know. If you have any questions, please reach out to your surgeon, because this is very different how different surgeons handle this, and it's really important that you take good care of your drains. We wish you luck in your surgery and your recovery process. Can't wait to see you soon.